What's up?
It's 4:30 somewhere. As in, it's 4:30 right here.
It's NA beer
And boy, I'm
o'clock.
feeling it. Yeah. You have water.
Yeah, I'm enjoying a nice ice water.
I'm rocking an NA beer, waters for squares.
Rocks glass, ice water.
You should get like a little fancy cocktail ice.
Cocktail, like an ice ball.
Yeah.
Oh, God. That would be really fun, actually. Just taking my ice water drinking to the next level.
Hot or not, ice balls in your water.
Hot. I feel like at Western states, there
Super
should
fancy.
be more ice balls
More cocktail
out there.
ice.
Yes.
I want Sonic ice at aid stations. Like, shout out to my fellow Southerners / Midwesterners. I think that's where Sonic is from.
That's like
Sonic's
that-
from Oklahoma, I
That,
think.
like, crushed ice?
Yeah, the crushed ice.
You just, like, drink it up with each sip.
Yeah, but it'd also be really good to put in all your nooks and crannies
Yeah.
to ice them down.
Oh, well, it's a cold day in Colorado here, and time for another podcast episode.
Time for another podcast. What are we talking about today?
We're going to do a little hot or not, and our topics
Perfect.
are going to be kind of related to recovery and injury, because we're going to talk about some best practices and strategies for navigating injury for runners. And then we're going to get into some questions from Reddit. We've got about 6 to 8
I love these.
questions.
How many do you think we're realistically going to answer?
4.
Yeah.
But you know, I've got high hopes. I've got high hopes for this episode. A lot of these questions span the whole spectrum.
Yeah.
Of the
I bet
running
they
experience.
do. I made you pick them out this week.
Yeah.
I thought it would be educational for you. Did you feel educated?
I feel like there's a lot of
Do you
people
feel
out
10%
there.
dumber just by being on the ultra running Reddit?
No, I think there's a lot of people out there who would really benefit from from having a coach in their life.
And critical reading skills.
There's people out there asking. There's like questions every day that people are asking.
There's a million questions.
And
every
then
day.
there's just people who you have no idea what their experience level is. weighing
Answering
in.
them. Yeah. It's so good.
It's so interesting. So yeah, let's get into it. Hot or not, compression boots or pants. I guess compression pants.
Compression pants. So these were originally invented for folks with diabetes who have issues with circulation, and the idea is that they increase your circulation. Evidence shows they improve people's circulation on the order of a gentle 20-minute walk. So if you're unable to take a gentle 20-minute walk and you do have $1,000, then boy, oh boy, are these hot.
Are they $1,000 now for those
They're like
boots?
$1,000.
Oh man.
We have a pair.
Yes.
We got them for free.
Yep.
We do use them. I do like them, but do they help improve their circulation? Yes. Are there any studies directly showing that they improve your performance? Absolutely not.
Or
Is this
recovery.
something? Yeah, or recovery. Again, like the thing that makes them good is that they make you sit, which is good for you, and they also make you circulate, which is good for you. However, sitting and circulating are two of the most achievable recovery states of being of all time. So this is
okay.
not something I would recommend people spend money on.
Coming in with a different take on this. If you are struggling to find that time to rest, putting those boots on facilitates that. That's a good thing.
But you could also then they're as good at helping you recover as Game of Thrones.
Right. But sometimes people need something to facilitate that thing that they really need.
Yes,
and then
but
they misinterpret what's actually happening.
But saying boots are good for recovery because they make you sit, what you're actually saying is resting is good for recovery. So I feel uncomfortable saying it's the boots. The boots make you sit, and the sitting is good for recovery.
The boots are the vehicle for sitting.
Yes, but there's no indication in the evidence that they directly improve your ability to recover.
Correct.
And because they are expensive, because of that, I never recommend athletes buy something just because, well, what's the harm? That's a really dumb way to go about living your life.
I mean, it's a pretty expensive thing to do if all you really need to do is take a walk around the block.
Yeah. If you struggle to sit, but you don't struggle to find $1,000, please get in touch. I have so many questions about your lifestyle and saving habits.
So yes, the research doesn't really support these actually helping with recovery. I do think that if they feel good to you, if you enjoy them.
Dude,
if
call me.
there's-
I'll come to your house. I'll sit on you for free.
What?
Yeah.
my
If you need
God.
help, if you need accountability, I'll come sit on you.
Watch out, people.
I'll be making house calls to sit on my athletes.
How much would
But
you
not in a
charge
creepy
for
way.
that?
Free. If you let me pick
Free.
the movie, you know,
Oh, if
I'll
it's
come
for
sit
a movie,
on you.
it's a movie date. Got it.
Yeah.
Got it.
Just bring popcorn and we'll recover together. It'll be great.
I think if you think that these work for you, great.
There is also a difference between an actual intervention and the placebo effect, and I do not think it is responsible to recommend something without having evidence. So
It's okay for things to feel good.
it's
and
okay
you
for
do
things to
them.
feel good, but I would not recommend them. And I want people to hear this and hear me say I don't recommend it.
Okay, I just think that it's good that you're making a distinction between it's okay that they make you feel good and I'm not recommending you spend $1,000 on this to
Yeah.
feel good.
Like if you find a pair in a dumpster, absolutely pull them out. I recommend dumpster diving for these, I guess.
I mean, we got a pair for free.
Mm-hmm.
Thanks, Coach Drew. And I definitely wasn't about to turn down a pair of these because I personally
feel nice.
I enjoy them. Yeah.
They definitely feel. I actually, well, one thing that is nice is like after you run a 100 or like a really long race, like oftentimes your legs swell and like walking around a bunch genuinely doesn't feel that great. So I will notice they can help like bring down puffiness in legs and feet the day after.
So is it worth it?
Also, you can put your feet up a wall. So
Could be painful to do that after 100. Depends on how
yeah,
those
but also
hamstrings
so are
feel.
the squeezy boots. Like feel like, you know, when your feet are twice the size of normal and like, I mean, my legs like are 30% bigger. Like they're just like, you know, I retain water. They're swollen.
Right, sure.
It's a hot mess down there. So I'm, you know, follow the science is my, I guess, final 10 cents
Let's
here.
follow the science over to icing. Hot or not?
Not hot. So this is another thing that I feel like we've known that this isn't a thing since like the 80s, but I still see athletes all the time come in
All the
hot with
time.
like, oh, my foot hurts, so I started icing it. I'm like, oh my God. Like now, instead of the rice method, which is kind of an outdated thing, there's I can't remember exactly what it stands for, but it's the peace and love. So Google peace and love. Which, you know, like icing, what it does is it tamps down on inflammation. Now that our scientific understanding of inflammation has improved, we understand that it's not an inherently negative thing, and it's oftentimes like part of the healing process.
Right.
So if you tamp down on inflammation, you're actually stopping the healing process. And there's lots of different types of injuries, like tendon injuries, where you absolutely don't want to like prevent blood flow from going into the area. Like
Right.
that is counterproductive. And, you know, similarly to like the like cold plunges or like ice baths, that tamps down on inflammation, but inflammation is an important part of the adaptation process. So the only time where like ice baths are helpful is sort of like if you were playing like a tournament, or if you had like maybe if you had like a marathon one day and like a half marathon the next day, that could be helpful, because your primary goal there isn't to adapt, it's to reduce inflammation between bouts of high intensity exercise. So
Correct.
Icing, not cool since the 80s.
Yeah, I would not ice unless specifically directed by a healthcare professional.
Correct. Yeah.
Not the default mode of operating. Massage gun or Theragun, hot or not?
This is another thing that feels good but has really mixed evidence behind it. This is another thing that we also got for free and I do use, and I also understand that the evidence is really mixed. So
I'm going to come back at you on this a little bit. I have not personally seen the study, but my board certified physical therapist says that in certain circumstances, Theragun is just as good as dry needling.
for what?
In specific
Well,
circumstances.
so I'm thinking of like for
to
improving performance. Like Theraguns
we're
don't
thinking
improve
about
performance.
injury recovery. This is injury recovery.
Well, what aspects of that? Because like those can be really distinct mechanisms.
Dealing with a trigger point or muscle tightness.
Yeah, if you have like muscle, so like there's some, so like if you have like lower leg issues, like using it to release your like gastroc or soleus, that can be useful.
Right.
So it's like there's very certain circumstances, but on the whole, they're not shown. I haven't seen any evidence that shows they prevent injury, and I'd be curious to see if that exists. So if
Prevents injury.
Yeah.
Oh, interesting. Well, no, I think this is like thinking about it in terms of, can this help me
Loosen, does it loosen?
recovery from injury or get over a niggle, any of these things that we've even already talked about.
Yeah, but that, again, that's just still such a specific test case.
Right.
So
you're going not hot?
I'm going not hot. I would not buy one. I would say the best thing you can do is like try to avoid injury. Spend that money on a PT, and then if it's a good PT, they'll probably have one for you if you need it.
Yeah, but they're going to charge you like $100 an hour to use a Theragun. I can't believe some of these places that have compression boots, how much they charge per hour to like get into those things.
Yeah, it's amazing. It's a good hustle.
And I know people like out there will go and like pay for that.
Oh yeah.
I mean, first of all, think about how many times you're going and think about whether or not it's just a better option to buy your own pair. But secondly, like,
or just go on a gentle toy.
Walk around the block could actually be just as helpful. I actually think the Theragun is really hot. My muscles get pretty tight, and I think that it helps me loosen up. And whether or not there's evidence to support that or not, other than N of 1, I don't really know. I haven't seen a study on like the effectiveness of Theraguns. But the people on my kind of like team tell me use the Theragun.
Yeah.
And I trust them.
Well, I'm just thinking, I don't know about the injury prevention. I know it has like sports massage has been studied to see if it improves athlete performance, and it does not.
Right.
So.
Like, but there must be something to it, like sports massage, for example, because, if you look at athletes in the Peloton on the Tour de France, after every single stage, they get a massage.
And cyclists have never, ever been known to succumb to pseudoscience.
Well, they do it. They do
a lot of crazy shit. They also, like, smuggled bags of blood in dog beds across the Spanish border. So, like, I'm not going to be out here trying to tell people to emulate cyclists.
Again, I think if you feel like it's good for you.
Even the best in the world do a lot of crazy shit. I tend to spend my money and make decisions when there is a good chunk of evidence, not just like some fast guy,
right,
who also has like a live-in chef and who also doesn't have a full-time job and who also might be reinfusing himself with blood from when he trained in the high Himalaya. So,
well, I don't think it's fair to say to assert that the athletes in the Peloton are doping, but I do think it's fair to assert that they have some of the privileges that many other athletes do not have.
Cupping is something that's been debunked many, many times, and think about how many pro athletes do cupping.
Right, but fascial health is very important for injury prevention.
There are no studies that support cupping at this point.
But fascial health is important for injury prevention, so how you go about having a healthy fascia, I don't know. I guess the jury's out on that.
I guess the jury's out. All I'm saying is cupping is not supported by the existing evidence. Looking at you, Michael Phelps. And I know that's like tough for people to hear, that like the athletes they look up to are dumb, but like breaking news, the athletes you look up to are dumb.
Are they dumb, or are they just doing something that they believe works for them?
They're doing something that they believe works for them. And I guess if your definition of dumb,
I'm curious how many things you do that like...
I do a ton of dumb stuff as well, but I just try to not pass that on to other people. I'm less proud of it. I don't flaunt it. I don't wear my stupidity on my shoulders like a cupping scar. I hide it. I have the proper amount of shame about it because I recognize that I'm in a position of authority.
Hide it, don't tell anybody about it.
Yes, like a normal person.
Okay, NSAIDs, hot or not?
How much do you want your kidneys?
Pretty badly.
Then not that hot.
Yeah.
So
not hot.
I think they're still banned in UTMB race, which actually
they
like,
are.
So I would never recommend using these in competition because there is there's mixed evidence on if it actually if minimizing pain improves performance in ultramarathons. There is evidence that it can impede kidney health, something you don't really want to impede when you're running a very long way and already putting a ton of strain on your kidneys because of dehydration and muscle breakdown. And also and then in terms of like training, sometimes athletes they call it like vitamin I or whatever, vitamin ibuprofen, and they'll pop it like prophylactically. And that's not a good practice either. Cause again, it minimizes, inflammation and minimizes pain. Pain is an important source of information. Paying attention to discomfort in your body is a really important skill for athletes to tap into. And again, inflammation isn't an inherently negative thing that needs to be tamped down on. It's something that, if it's chronic, systemic, and unintentional, that's not good. But we inflict inflammation intentionally in training to get adaptation. So minimizing that impedes adaptation.
Right. Like there's a reason why you feel sore. Mm-hmm. There's a reason why you have pain. These things don't happen for no reason out of the blue. They are the signals that your body is sending to you in order for you to like take action.
Correct.
And to understand maybe the stress of what you've done or like the outcome of what you've done.
Yeah.
Like, so there's a lot of, there's a lot of reasons for that. Like these things don't happen for no reason. So if you dumb that down, you're dumbing down like your body's natural processes, which is probably going to have downstream effects. Yep. I think specifically when we talk about icing, NSAIDs, those kind of things used during like when you're feeling an acute injury to kind of like try to train through it or to mask some of the underlying symptoms of pain, soreness. You're just delaying more inflammatory process. You need that inflammation to heal. And then if you feel inflamed, like for example, you do a hard bout of downhill running on the weekend and your quads get sore. Yeah. So you take NSAIDs in order to like feel less sore.
You're kneecapping your
inhibiting the adaptation process. Like you need that inflammation in order for your body to break down and build back stronger so you have more resilient quads so you can go back and run that same, loop that you did and feel less sore the next time and be ready for, your upcoming event.
Exactly.
So not a lot of evidence to support these common methods.
For acute injury, NSAIDs can be very helpful.
I think when directed by a healthcare professional, I wouldn't be, and I personally don't take NSAIDs. I haven't, I can't remember the last time I took Advil, but I
get headaches and I take it for that. And
right,
I also,
like a headache, sore throat.
Sometimes I'll have kind of gnarly back pain from my scoliosis. So
if you're directed by a healthcare professional, some way to deal with chronic back pain is to take these pills.
Well,
okay,
not chronic. I mean, usually I try to strength
it's I'm just like if I get a flare up. Out of this.
I have. It's gotten better. Don't make fun. It's working. I haven't been to the chiropractor in a long time.
That's good. I just went earlier last week.
See?
Yeah. I'm old, though. I'm older than you.
Yeah. Speaking of old, decrepit athletes.
We have one on the podcast here. Watch out.
What are we talking about today? What is the bulk of this conversation about?
Well, not the bulk, but...
What is some of this conversation?
A third.
A healthy third.
A healthy third. Best practices and strategies for navigating injury.
So why did you want to talk about this today? Because this was not my idea. This was a TJ idea.
Well, I'm going through an injury right now.
What happened?
And it's been a while since I've had an injury. It's been
what was
years.
Your last injury?
I don't remember.
Was it your ankle thing?
My sprained ankle in 2021.
Yeah. Wow.
Yeah.
Very durable.
Right?
Strong.
A lot of pizzas.
A lot of pizzas.
A lot of pizza, a lot of protein shakes.
So what's going on? What happened?
Well, it's a really weird injury to talk about.
It actually when you said I'm injured today, I was like, no, you're not. What did you do on your run today that you got injured? And I didn't realize that this was what you were talking about.
Right. I have gastritis is the diagnosis.
So you have a tummy injury.
I have an injury to my stomach lining.
An inside injury.
Yes. Inflammation of the stomach lining. And it occurred, it happened during the race 3 weeks ago. I started to get a burning sensation in my stomach, and I was like, "Oh, this is just because you're pushing hard and also
because what doesn't burn during a
right?
Everything burns."
I'm going as hard as I can, and I'm also doing 100 grams of carbs an hour.
Yeah.
So
hell yeah.
Yeah, this is what it's supposed to feel like, and I felt pretty crappy after the race. As you
confirm,
can
you were a major bummer.
Was not good.
Huge bummer.
Come on, we did a lot of fun stuff. in San Francisco, and I did that feeling pretty shitty.
Yeah.
So
you were also being a poop when I just wanted
kudos to me.
Walk around.
Kudos to me.
And eat Filipino food.
It's not easy to do anything when you have pain in your stomach that you can't get to go away.
Yeah.
So, anyways, fast forward couple weeks, that pain didn't really go away. It sort of was minimized, and then I started to get back into training, and it came back. And it came back in a very bad way, where I had like severe pain in my stomach all day long for 2-3 days in a row following these runs. Then it would go away, and then I'd try to do another long run, and lo and behold, it would come back. It's just like classic injury stuff. Like you try to push through it, you listen to your body, you rest, then you try to do it again, your body says no. So then I went to the doctor.
Yeah.
And
Good
then
call.
the doctor
Probably
was
should
like,
have done that sooner.
well,
Also, it's Thanksgiving.
Yes, and I did consult with my sister, who is a
doctor.
physician,
Yeah.
and she told me likely you have gastritis, which is inflammation of the stomach lining. Do this, and then it didn't go away with what she told me to do. So then I went to my doctor, and my doctor was like, "Yeah, you stressed yourself really hard in that race. It affected your stomach lining. This is not uncommon. Okay, here's what to do. You need to do what your sister said to do, but for longer with stronger drugs."
Yeah.
So I was like, okay, great.
You had me at stronger drugs.
I love strong drugs. And so I went to
Says the guy that won't take Tylenol.
I went to the pharmacy. I mean, I haven't gotten to get prescription drugs in 4, 5, 6 years since I had strep throat. And I think that was like 10 years ago.
Yeah, but you like pop a ton of allergy pills.
Oh, that's right. I forgot about those allergy pills.
You have insane allergies.
Okay. That's with
100% of your
like,
medical issues are from exercising too hard.
I know. Gosh. You think I would learn?
Well, they're all from like weird freak. Like it's not like you have like a repetitive like over exercising thing. It's always from like one weird thing.
Why can't my like patella tendon hurt?
Right,
Instead,
like a normal
like,
runner.
I just get allergies.
Although you did have plantar fasciitis for like 3 years. It was like a personality trait when I first met you.
My planner.
Yeah.
It was good once I got over
And then you
that.
passed it to me. And then now neither of us have it.
It's awesome. It's about that inflammation process.
All about that inflammation.
Just get stronger.
So what do you see, like what do athletes, like as a coach, how do you help athletes navigate injury? Like what are those first like kind of moments of like, oh shoot, I might be injured look like? And how do you think athletes should react in those moments?
Well, I think it's important for athletes to just like understand why injury is challenging.
Yeah.
And you know, injury is a vulnerable time. And I think a lot of it comes down to feeling like you have a lack of sense of control. And that can be hard to deal with. Like your body's not functioning the way it's supposed to function, whether it's your stomach or your knee hurts or you sprained your ankle. Like things aren't functioning in the way that you're used to them functioning. And so you can't control that. You can't control the timeline it takes to heal. You can't control the level of pain when it comes on. Like something that I've noticed about this is like I will have like really, really bad pain in my stomach. And it's hard to do anything. And it's extremely mentally taxing. And then it will just go away. And I don't understand it. And then I'll think I'm normal. And then like it's like, oh, go and do some stuff. And then it'll come back. And it's, you know, that kind of roller coaster and that feeling of like, how do I navigate this? I have no control over this situation makes it a lot higher of a likelihood, especially if combined with other things like identity and some stuff we'll get into a little bit later can make like the challenge of the injury even harder to go through. So it's just like, why is it hard? Because you're vulnerable. Like you lose that sense of control. Your body's not working the way you're used to it working. And that is a hard place to be in. So I think, you know, it's really important to understand that like how your body feels, like your mind can pick up on that. So if your body's not functioning right, it's easy for your mind to follow in that direction if you don't know what to do. And because like you're not able to participate in your sport, that can make it difficult to access community, which then you are going to end up feeling much more isolated without like those people to talk about this stuff with, about like having, you know, friends around you. And those really important things that we'll get into is like, what can you do during injury to help make the process a little less burdensome or a little less challenging. But, you know, all of these things get exacerbated. So like if you're dealing with injury and then mentally things start to get hard, it's going to be a lot worse. The road to recovery is going to be more difficult. So just understanding how those things function and work together and knowing that can kind of give you an understanding for why you feel the way that you feel. And I think it's, if you're going to make changes, if you're going to try to navigate an injury, it's always important to understand, why is this like this? What are the roots of this?
Yeah. I would also say like the number one, I mean, usually, so like sometimes freak stuff happens, gastritis, or like you trip on a rock, you like fall, you like sprain an ankle in a race. Sometimes stuff happens, but the majority of injuries happen from not eating enough and training too much and not recovering. So like if you want to not be injured, the best things you can do are make sure you are always meeting your energy needs. Make sure to recover, emphasizing sleep, managing stress, remembering the body knows stress, not miles, and you can't continually take on more and more stress in the form of both training load and life stress and continue to adapt. Like there will be a breaking point. So you have to make sure you keep all of those things in balance.
And that's one of the, so how do we ease the burdens of injury, right? Like, what do we do when we're experiencing injury, and how do we make sure that we navigate it in a way that serves like the highest healing we can have?
You quit running.
You quit running altogether. You never pursue anything you love again. No, the first thing to do is when you're experiencing an injury is to go to your like peer level support, whatever your community is basically, or the team that you have around you. Like if you're an athlete listening to this and you don't have a team, like you don't have a coach or a therapist or a PT you see or friends that you run with, like, and you're not injured right now, immediately start to cultivate those things.
Yeah, also the wrong time to panic and try to find a coach or a PT or a therapist is when you're injured. Like,
but to be
ideally
honest,
you have those, like you have a network before you have a devastating running injury.
Absolutely, because these are the things that you have to lean on when you're going through this challenge. But if you don't have those things now and you're hearing this, go and start to cultivate those things.
Yeah.
You would be probably, you're not surprised by this, but maybe listeners would be surprised that a major catalyst for athletes seeking coaching is, I'm going through an injury.
Yep.
And although that can be a good catalyst to find a coach, it's not always the most ideal time to start getting coaching because you're injured. The process isn't going to be about the training. It's going to be about giving you support for recovery. And although that can be helpful, they're really two separate things, training and recovering from an injury. So if you can bring that coach in before injury, they can get to know you and understand you. Then if you do get injured, that support can be much more tailored to you.
Yeah, I think one of the most common reasons that the athletes get injured pre-coaching is usually because they get stuck in these like injury cycles of like they don't train, then they sign up for something, and then they have to they go from like 0 to 60 and they start training a bunch. Then they get hurt, so they can't train, but they still want to run. So as soon as they get healthy again, they do way too much, they get injured, and they're back to 0. And we see that time and time again. Like even like one of these Reddit questions, I'm gonna spoiler alert here, but it's like this person is only running 2 days a week. Like that is not nearly enough consistency to like to teach your bones how to remodel in the way that you need them to remodel to become a runner.
No, totally. Oh my gosh, the answers to that question.
Sorry, I'm just distracted thinking about it. So I'm like, oh my God, you're only running 2 days a week. Like, oh, that's like just enough running to get hurt and also never get better.
Right. 100%.
That's like the chef's kiss of terrible ideas.
The kiss of death.
For when you want to like always hurt, but also never progress. Love it.
All right. We'll get into it.
So like an athlete is hurt. What's the first thing they should do? Because like usually for me, if I have an A, don't panic. B, don't run through it. I usually say like if it like, especially if the way the symptoms are presenting change during the run or after, that's a big sign that we need to stop what we're doing and take 3 days off.
Totally.
Ideally 3 days, like totally off. It's always a red flag for me when an athlete, when I say, hey, let's rest. And they're like, can I bike for 3 hours? And I'm like, that's
not rest.
This is likely why our body is so stressed that these things are happening. Like if you're someone that really struggles to take time off, and when you get injured, you immediately think you have to jump into like a crazy amount of cross training, that could be a good moment to step back and really look at how your movement patterns and how your relationship with exercise and movement may or may not be playing into a context that makes you more prone to injury development.
Totally. And I think that's why the first thing you do is you go to your support group, whether that's go to your PT to obtain a diagnosis on what's going on, or you go to a doctor like I did. Or, whomever it is, talk to your coach. Okay, you're experiencing this. Then your coach says, go to a doctor. Once you've obtained that diagnosis, then you create your plan for care. And when you have that plan for care, then it's really helpful as an athlete for you to go back to your team and say, these are the specific ways that you can support me through this injury. Mm-hmm. That way you invite those supporters in and you tell them what you need, because they're not going to know what you need. Don't assume that they do.
Yeah.
Even coaches who are super experienced, even PTs who are super experienced but are getting a diagnosis down from a sports medical doctor or something, they may not specifically know what your needs are. Maybe your needs are more emotional than they are like accountability to doing specific work, or accountability
or to not
just
doing
resting,
stuff,
or just resting. So be specific, build awareness around what you need, and then go to your team and ask for those things. If you're with a good PT, a good coach, they should also prompt you and ask you, what do you think you need? Because it should be a two-way street. But also don't wait. Ask for what you need and invite those people in, because they're part of your trusted team. They're there to support you, and they're hugely important when going through an injury.
Yeah, I'm always really collaborative with athletes who are going through an injury, because just because they're maybe not training or doing workouts in the same way they were previously, it's so important we stay in touch and monitor symptoms. And that's usually where things are a little more touch and go. Like I usually tend to update athletes' training plans like on a more daily cadence at that point, just because it's like, we need to take the information from the day to evolve the training plan. And so I would say it's like, if you're an athlete with a coach, like injury is not permission to drop off the face of the earth. Even if you're not running, like I need to know how your elliptical felt. I need to know how your PT felt. I need to know how you're eating and sleeping and how all this recovery is going and how you're managing stress, because all of that information is increasingly important in the context of injury and recovery.
That's right. And so another, I think if we're going to do okay, first thing, go get with your team, tell them you're feeling injured. Second thing, get a diagnosis. Third thing, develop a plan for care. I think the fourth thing, ask people for the help that you need and be explicit and specific with what those things are. The fifth thing would then be, okay, develop some self-leadership or some self-discipline in this process. What can you control? What aspects of this process can you reclaim? Because one of the primary mental and emotional struggles through injury is that I'm not in control. My body isn't doing what I'm telling it to do, what I want it to do, and what I'm used to it doing. And I have no idea what the timeline is for when I'm going to be able to do what I want to do again.
Yeah.
And at the level that I'm used to. So reclaim what you can. Start with the big picture things like sleep, eating healthy foods, drinking healthy beverages. Then, from there, move on to other stuff that, is proven to work, like mindfulness practices, journaling, meditation, breath work, time outside, build awareness, especially around your feelings and your emotions. Like, just commit to feeling your emotions all the way through to completion. Whatever I'm feeling, it's, okay. And I'm going to meet that with non-judgment. And if I need to express that to somebody, I'll express it to a coach, someone who's trusted. If I need to externalize it, I'm going to do that. If I want to journal about it, I'm going to do that. But I'm going to get those thoughts and feelings out there and not feel like I need to push them down and like heroically get through this what I'm feeling.
Yeah, and I think that paying attention to those feelings, and I think that injury can be a really educational and informative time for athletes. And just to speak really candidly, in the times that I've been injured, those moments have been so scary to me, and the feelings that were that like the profound discomfort I experienced because of those feelings made me realize, like, wow, I really do need to continue to assess my relationship to movement and exercise. I need to continue to emphasize my eating disorder recovery, because
Right.
like injury and time away from movement and exercise and training can be very triggering, and sometimes you don't even know that those things are still pretty present for you until they're sort of like resurfaced with something like injury. And so, working with endurance athletes, which are a population which are quite at risk for a lot of those issues, just knowing that, like, if those things come up, like, A, it's normal, and B, like, that's a great time to really invest in your mental health, and to make sure that you're taking care of yourself in a way that when you return to sport, maybe some like disordered, dysregulated eating or exercise patterns that might have contributed to your injury, you can have healed a lot of those as well.
Totally, absolutely. I mean, there's opportunity here, but I think it starts with those basics, and then, as you start to feel better and you navigate the situation, then you can kind of take stock in some of the things that you mentioned, which was like identity.
Yeah.
How much of myself is tied up in this?
Yeah.
How much do I feel like I'm losing by not being able to participate in my sport right now? Injury is a real opportunity to assess that, but I don't think it's helpful to assess that until maybe you've gotten to that place of acceptance around the injury,
right,
and patience, where like, I'm going to take a patient approach, and I'm going to, hit these discrete steps along the way in order to get the outcome I want, which is to be healthy and return to, normal activity levels.
I never think it's the wrong time to invest in your mental health.
Yeah.
So what are the conversations that you're having with athletes at this juncture in their injury recovery process? Like, what do you specifically see people struggle with, and how do you help them navigate that?
I think a lot of it is tied to the identity piece.
Like, if I'm not running, am I still a runner? And if I'm not a runner, who am I?
Yeah, exactly. Like, if I can't, pursue my sport at the level that I'm used to, am I really me? I think that's just a great insight into how narrow an identity can get around athletics, and how the narrower the identity is, the greater the fallout when there's injury.
Yes.
And the harder it is, the more self-imposed friction we put on the process of going through injury. I usually have athletes then try to do some things that help them zoom out. So time with friends, really limit social media use and phone use. Social media is just a gateway to comparison and to see,
go ahead
like,
and
all
delete the Strava app.
Right, like, you just see everybody doing the sport that you can't, do because you're on the bench because of injury. I would say only use your phone if it's necessary for getting in touch with your friends, family, and people on your team. If not, just try to put the phone aside. And then focus on long-term goals. So having that zoomed out approach, like, okay, these goals in 6 months from now are still on the table. Like, what I do now and how I recover from this injury now is going to directly impact how successful I am at that. So let me orient my thoughts, words, and actions to that place in the future. And that's where I really want to go into the fact that, like, it's important for athletes to determine, how do I want to show up? Who do I want to be during this injury? And what can I create to navigate this situation in a way that puts me in the driver's seat of the process and is action oriented and supports that long-term vision that I have for, like, what is that next goal that I really want to do? If you don't do this, you're going to be at the mercy of the non-linear process, the ebb and flow of recovery from an injury, which is an up and down process. So if you don't know who you want to be and how you want to show up to navigate this, you're going to be floundering out there trying to figure that out, and it's going to hurt a lot worse.
Yeah, that's something I always work on with athletes who are navigating injuries. Like, anyone can be an athlete when it's easy and when the progress is linear and the growth is easy and consistent. But what defines us most as athletes and as people is how we show up in those moments of struggle and setback. Like real champions push through those moments, right? Like it's not just about like, oh, I had a great day and I was able to persevere through having an easy day. It's like, no, how do you want to be when things aren't going your way? Who are you in those moments? And like, are you going to define that moment or will you let it define you?
Right. And I think there's probably some mindsets or some things to focus on, some attitudes that you could have that would be more helpful. For example, acceptance around the situation. That's going to lead you to a more present state, not putting up as much resistance to what's happening. That's going to allow you to address the challenges that you have. Curiosity. Why did this happen? What can I learn from this? That commitment to learning kind of in there with curiosity. Like, what can I learn from this that's going to help me be a more resilient athlete in the future? And I would say non-judgment. Like, if you're not getting hurt at certain phases in the process, you're probably not training hard enough.
Yeah.
Like, injury is inevitable in a sport like running. It's a part of the process because we're putting a lot of stress on our bodies, and our aerobic systems grow much faster than our structural musculoskeletal system. So eventually we will reach the point where what we can do aerobically exceeds what we're able to handle structurally. How this shows up, we don't want catastrophic injuries, obviously.
Right.
And we can avoid those things by having good practices. But niggles and things that are going to sideline you for a time are a part of this process.
Right, because
so
if you're
understanding
maximizing your potential, you're riding that knife's edge.
Right.
Of like, I am getting the most out of training possible. And ideally, you never teeter over into that, like, my reach just barely exceeded my grasp in that moment of training. But also, if you never are close to it, then you're leaving some potential on the table. And like, we really do try to strike that perfect balance, but it is a narrow line to walk. And I think that, something that I really want to encourage athletes is to not tell yourself a story about your durability or your injury story. Because it's sort of like the same man will never stand in the same river. We work with a lot of athletes who have had like repeated injury cycles, and maybe it'll be their first time working with a coach and they're like, oh, I can't run more than 40 miles in a week because I'll get hurt. And I'm like, yeah, well, you're working with a coach for the first time, and like, we've got you doing strength training for the first time, and like, we've got you doing workouts, and like, now you actually understand what recovery effort is. So like, 40 miles now is very different than 40 miles back then. And you should, if you're eating enough and recovering, you're always getting more durable. Like, your ability to withstand load will continue to improve. And like, yes, as athletes age, that does change, particularly with women and bone density concerns, but we can ameliorate a lot of that with some strength training, resistance training, and making sure that athletes consume enough protein and potentially swapping in a little more low impact cross training. So I don't want athletes to ever tell themselves a story about what they can or can't handle, as long as we are trying to adapt and learn and integrate new evidence-based strategies along the way. And it's also one of the hardest parts that I see with athletes of injury recovery is like, our brains are so smart and adaptable. And unfortunately, what that means is they get really good at protecting us. So like, especially if someone has had a longer term, like chronic injury, your brain will rewire itself to protect that injury. So you will literally have to retrain yourself to run again without like favoring a certain leg, or like how to run downhill fast again, or trust yourself to run hard in a workout again, or trust yourself to run, that first step longer than you have in quite a while.
Well, not to dive too deep down the rabbit hole, but it's not just the brain that learns these things, it's the nervous system too. So that's where it really becomes challenging, where the brain might logically understand I'm healthy and I'm durable, but the nervous system and the feeling that you have in your body, which often comes from the nervous system activating due to a past experience, maybe a really challenging injury, the nervous system doesn't forget either. And so the nervous system has to relearn and retrust.
Right.
And there's a juxtaposition that happens where our belief system is one thing, and then the evidence is another thing. So it's like my feeling is I'm injury prone, and it's affirmed by how I feel because maybe my nervous system actually activates. Logically, I understand I've done the steps that help me to not be injury prone anymore. But then you really need to take a look at the evidence because you can only really change like how your nervous system's responding to these things when you're holding that evidence there. Like, I have done these discrete steps
And I think just
in this amount of time. And
being
that's,
aware of why it's hard and
Well,
being
sure.
kind to yourself as well, but understanding that that is a process of healing. It's like you have to heal you have to rewire your brain. You have to re-equilibrate your central nervous system to understand that like you can run on your hip without breaking it, or like you will not, like I used to get so nervous doing long races because like in every 100-miler I did, something really hurt at the end, and like it doesn't happen anymore, but there's like always a part of my body that's like, oh, when is something gonna go horribly wrong? Like, when is my knee gonna blow up, or when is my foot gonna start to really hurt? And like it's just, being able to like say like, yes, body, brain, I hear you, let's like bear with me, let's work through this, and just understand that's a very normal part of the injury process, but you should not let it push you around either.
Well, that's where, knowing who you want to be and how you want to show up, and just trying to
And
be in the
PTs
driver's
can
seat.
help with that as well. Oftentimes, like just making sure you're doing like functional movement and like really isolating movement patterns in a controlled environment can be really helpful.
I would say if you're really struggling with that, furthermore, is to work with a therapist to develop that trust and to kind of rewire the nervous system and the brain and the belief system that can develop through these cycles of injury. Just lastly, before we go on to a couple questions, in our last little bit of time here, if you are an athlete listening to this and you are not already practicing things like mindfulness, stress management skills, if you don't
If
have
you're not managing stress, you are really holding yourself back.
if you don't have a team around you, start working on those things now, because the evidence suggests that if you have these pre-existing positive characteristics, if you have a team around you, you have friends that you connect with, if you have other hobbies and things that you are interested in spending your time on, they will significantly aid you in the recovery process. And athletes who do not have those things have a lot more difficult time dealing with the challenges that come from injury. And, it's obviously important to lower stress during periods of injury. But things like stress, isolation, anxiety, depression, all that stuff, if left untreated, just makes it harder to recover. And it will impede your process to getting back to where you want to be. So if you're not addressing those things, just understand the time scale for you to get better is going to be longer. I think that's a tough thing sometimes for athletes to hear, on the ground floor of this with a lot of athletes over my coaching career. Those things just simply, people ignore them and they wonder why they don't recover quickly. So get on top of that stuff, guys. All right, let's get into some questions from Reddit.
How are you feeling about your injury? Where are you at right now?
That's a great question. I appreciate you asking that, Zoe, because it gives me an opportunity to reflect on some of these things. I feel exhausted by it because of how much I've had to just get through the day-to-day of my work life feeling really shitty, to be completely honest with you. I feel pretty good today because the medication's working.
Yeah, people don't listen 48 minutes deep into the podcast to hear us faff around.
No, but I feel good
today. Give it to me.
But, the new medication has made a huge difference in not trying to accelerate my return to normal training. Like, my doctor is really specific.
Yeah.
Like, okay, right now you can only do 40 to 60 minutes comfortably. You should not exceed that over the next 2 weeks during this course of meds. And then after, you have to let discomfort be the guide. And I was like, okay, I really trust that. That seems like a really reasonable approach. It's helpful that I haven't, I can still run.
Right.
But sometimes today, 50 minutes into the run, my stomach started hurting. And so I was like, all right, let's see how it feels. If you need to cut it short and just go home, just go home.
Yeah.
And then it went away. But then after it's been a little dysregulated for a while, then I took a little bit more medication and it's fine again. So that up and down is a little bit of an emotional roller coaster, but I'm fortunate. Like I've built out a team.
Yeah.
I have a lot of hobbies. I've got 3 shows I'm playing this week, jazz shows. I've got,
A beautiful dog
yeah,
daughter.
I've got a dog that I can walk if I'm starting to feel like I need a little bit more time outside. And I've got work that I really enjoy, and athletes, clients that like I genuinely want to connect with. So I have a lot of outlets for self-expression, and as long as I'm not feeling too crappy, like I feel very present for those things. I think actually last week was really hard because I pushed through a lot of just feeling bad, and I probably should have taken a couple sick days and canceled a lot of calls.
Yeah.
I was like pretty much on the end of it by the end of last week. But then, the weekend came and I wasn't doing 5-6 hours of training. I rested hard.
Yeah.
And that was helpful. So, I don't know, I like going through the outline and just thinking about folks who are a lot smarter than me, lining up the do's and don'ts to dealing with injury recovery.
Yeah.
I was like, it's nice to know that I have a lot of these systems already in check because I've been doing this for a long time.
Yeah. Love it.
Okay, all right. Enough about me.
Let's talk about Reddit.
Hey everyone, new runner here. Been running 5 days a week.
That makes me, I'm so anxious already.
Been running 5 days a week consistently since the end of June, and I've ran 2 5K races, and 3 in 32.50. I just signed up to do my first 10K race in April. I was thinking of maybe aiming to do a half marathon towards the end of 2025. My Garmin predicts, as of now, my half marathon time would be a 2:47. If I start training after my 10K and plan to do the half towards the end of 2025, do you think I'll be good, or should I make it a 2026 goal? I love this question, Zoe, but I want you to get started with this.
I say that sounds awesome. What I like here is that this person's running 5 days a week consistently. Like, honestly, I feel like if you can run 5 days a week consistently, that's an amazing, like, that's the good shit, Like, you can build that volume much more sustainably and healthfully than someone who comes in at, like, 2 days a week.
Right.
I wouldn't hold very tight to that time that the watch is giving you, because, again, like, I have no idea how they make that calculation. You could probably use like a Jack Daniels VDOT calculator to extrapolate your half marathon time from the 5K. But also, when you're that new, I would just like not be too obsessed with the time necessarily. Like maybe go run the half marathon, and then you can get a time under you, and then start trying to improve that. But I think if you're running 5 days a week consistently, like honestly, half marathon's great. That seems totally doable.
This is one of the easiest Reddit questions we've ever encountered.
This is like the only time I'm not like. So it started off scary with the new runner here, but whoever you are, 5 days a week, consistent runner, get it, girlfriend.
No, you're doing a great job.
You're doing awesome.
Honestly, couple 5K races.
Get in there.
In your first year of training, culminating with a 10K in several months. You're well on your way.
Love that progress.
You're well on your way. Like a half marathon within the year, towards the end of the year. Wow, way to give yourself like.
Wouldn't sign up for Cocodona.
Yeah, more of a runway than you honestly actually need.
Like I have athletes running way less who come into the program and they're like, I want to do Leadville, and I'm like,
all right. So, I currently run about 20 miles per week. 10-kilometer runs 3 times a week, and I have an itch to get into ultra running. I've read quite a few posts on this, but I have a specific question which I couldn't find answers to. I'd like to get a race book for 2025. Is 50K a sensible distance to aim for? Is 100K too much to hope for? For training, are there good recommendations, plans available to help build up to training? How many days a week should I be aiming for in terms of training days?
So I'm going to say running 20 miles a week, going for 100K, that's way too big. Also, there is no one size fits all, but I really think most athletes should be running about 5 days a week. Some people can, get away with less and maybe we add in cross training. Some people do more, but 2 to 3 is like not really enough to adapt and progress in training. 3 is maybe just barely enough to minimize some injury risk, but you're really not.
I think you're right in that sweet spot for injury with 3 days a week.
I don't love 3 days of running a week. I would like to get that run frequency up. I feel like a 50K, I feel like if you have an itch for ultra running, like where's your itch to run 4 days a week,
Right.
Like if you want, do you actually want to run an ultra, or do you just want the Instagram post at the finish line of the 50K?
Right.
Because I would like to hear a lot more fire here around the training and less around the racing. Ultras are great goals for people who like training. If you don't like training, there's plenty of other things you can do with your time besides run ultras.
I totally agree. We don't know about this athlete's prior racing history. Have they done a marathon on 20 miles a week, or
even a marathon on 20 miles a week, girl.
It's not a lot. It's not a lot.
It's not
3
great.
times 3 runs a week. 3
I'm not loving it. I'm not loving
6-mile
it.
runs a week. 18 miles a week. I don't know. I think I think I would like to comfortably, for this athlete, see them get to 5 days a week.
Yeah.
See what kind of volume we could do if we were to increase that run frequency by 2 days, and then see where we're at in 6 months, and then maybe do a 50K.
Yeah.
I
don't think a 100K is a great distance for beginners.
It's way too much. I think that's doesn't even have the foundation to address whomever
person of any gender,
does not have the foundation,
any gendered moron
does not have the foundation.
Sorry,
to go for the 100K.
Not a moron. Just let's get that run frequency
person
up.
Navigating the questions that come up.
Numerically challenged runner.
What kind of plan would I recommend? I would recommend
running 5 days a week
plan that allows you to run 5 days a week with 1 workout and 1 long run.
Yeah, love that.
So you're working on some speed and you're gradually increasing that long run volume, ideally to a place where then you can work on your fueling.
Yeah.
So 2 hours plus, 90 minutes minimum, because you're really going to have to work on your fueling competence if you want to even touch that 50K distance in a safe way, because you're going to have to support all the training that you do up into that point. So there's really a lot of building blocks that have to be put in place here, I think. And you're probably I don't know what kind of plans there are available online for that. I only know that the best way to approach that is with individual one-on-one coaching.
Yeah. But yeah, I would say ideally hire a coach. If you actually have the itch for ultras, do it right. Build your frequency. Let these things take time. If you are only running 3 days a week, just build your frequency.
All right. This might be our last question.
Great.
We got a few for next week.
Hell yeah.
We'll let people we'll do a little foreshadowing here. Injury prevention question.
Ooh.
I feel my ankle stressing.
Oh.
What can I do to prevent an injury and allow myself to run more often? I run 2 times a week, but I really want to run 3 times. Right now, it's only a minor discomfort. Is stretching a good idea?
So stretching is not shown in the evidence to help with injury at all. Doesn't prevent injury, doesn't help heal injury. Stretching, not a thing.
It's a thing, but not a thing that does what you think it does.
It's not a thing that does what you think it does. I would say 2 times a week is just not enough running. And if you're feeling limited, doing more than that, it sounds like you might need a practice for helping build the durability. So this could be through PT, this could be through strength training.
Yeah.
With ankles, I really like getting athletes on a Mobo board or potentially working on dorsiflexion. It's hard to say, when, the ankle's a really complicated joint.
What does stressing mean? Do you feel pain?
A lot of times it's, peroneal tendon type stuff would sort of be my, if I just had to guess. So usually strengthening something and also making sure something isn't overactive and tight. And you could likely eliminate your risk for a lot of this by running slightly more so that you're running less more frequently throughout the week. Because oftentimes when we see people coming in with these low frequency run plans, they're running 2 or 3 times a week. They're doing 5, 6, 8 miles at a time. That's a huge concentration of stress. So you're hitting your body with a ton of stress. It gets really overwhelmed, and then it isn't actually ever taught how to recover or get more
it's
durable.
Just breaking down.
It's just breaking down. You're never really building. Ankles are really tough. That's definitely one where I feel like phoning a friend and working with a PT can be really, really beneficial. In strength training, if I have athletes that struggle with lower leg stuff and ankle stuff, we'll do Mobo board, we'll do single leg balancing. I think pogo hops can be really great for building that lower leg durability, just like light plyo, especially for runners who are newer to plyometric movement. I love a plyo hop, and for more advanced runners, sometimes getting up to a box jump or like a skater jump to work on some lateral movement or more explosive stuff, that can help with those lower legs and building joint durability as well. But if if anytime you try to run more, your ankle starts to hurt and you don't know what's going on, I feel like you got to recruit a PT to help diagnose what's going on with your ankle and address that. Maybe it's through strength, maybe it's through rest, maybe there's something else going on. Maybe you need like a better choice of footwear. Maybe there's something going on with your gait. That's less likely, but it could be a thing. Like maybe you're overstriding like crazy because you're only running 2 days a week, so your body actually has no idea how to run.
Right. I mean, there's only one really probably great way to approach this, and it's to go see a PT or a sports medical doctor and get a diagnosis.
Yeah.
Create a plan for care. And then if your big goal is to allow yourself to run more often, then you need to think about creating the action steps to get you to that place. So how do you systematically go from running 2 times a week to running what is ideal 5 times a week? Maybe that is beyond the scope of the question here and how much time we have available, but you can systematically get from 2 days a week to 5 days a week. It probably doesn't take athletes as long as they think.
Yeah, and 3 days a week, still not that great. 2 days, real bad. 3, not great.
3 is a step, but it's just a step. We really want to get to 5 days a week, help take the pressure off of any one training day, spread the stress out, have that frequency of run in order to develop the neural pathways that allow for more efficient, better running over time, which will help with injury prevention. I mean, the reasons for doing this, there are so many. Also, the strength stuff that you talked about. Great question.
Good
Thank
stuff.
you. Thank
See
you,
a
Reddit.
PT.
All right, guys.
Yeah, if you're ever hurt or sick, do not get on Reddit.
Yeah.
Don't do that. I mean, we'll answer your question, but like, talk to a professional.
If you guys have a question for a future call, something that you've been thinking about in training, hot or not topics, we're looking for some more ideas for 2025. So reach out. And if you'd like support in your running journey, we've got coaches who have roster spots available. We'd love to work with you and to hear from you. Microcosmcoaching@gmail.com, microcosm-coaching.com. See you guys.